What if I told you that your primary care could give you a green light or a perfect bill of health when in reality, different labs show a completely different story? This is such a massive topic that gets overlooked by so many medical professionals, and that is insulin resistance. We encounter so many patients on a day-to-day basis that have normal labs or even just slightly abnormal labs and are told that everything looks great, which brings us to the topic of insulin resistance. Now, insulin resistance is a condition where your body cells are not responding to insulin. Insulin is a hormone that regulates your glucose or blood sugar in your blood. Now, when you consume food, glucose will rise in your bloodstream and then triggers insulin to be secreted. So insulin can help unlock the door to your cells, so to speak, so glucose can get in. And if this pathway is not working properly, that forces your glucose to remain in your circulatory system versus get into your cells, which then makes your insulin production increase even more. There are labs that are so crucial to order, yet it's just not standard practice. So let's talk about your fasting insulin. Fasting insulin is the most valuable single lab test for predicting a good metabolic bill of health. When you have elevated fasting insulin, it is a massive red flag that your cells are under fire. It's showing a picture that your cells in your body are likely filling up with toxic excess fat, which is blocking that insulin-glucose exchange and not allowing glucose to actually get into your cells. This forces your pancreas to secrete even more insulin, trying to compensate and keep your blood sugar normal. Another major factor in this could actually be inflammation, which can still block the insulin-glucose exchange and from allowing glucose to get in your cells. Here's a perfect example of a patient who had a normal A1C, which can diagnose diabetes, and a very slightly elevated fasting glucose, which for some providers, as in this case, would have warranted no further testing. And then, of course, taking things one step further, and the labs that we ordered showed a completely different metabolic disaster. And I get asked this all the time: how can I be insulin resistant if my fasting glucose and my A1C are completely normal? And that is simply due to the fact of compensation. Your body will continue to produce large amounts of insulin in order to keep your blood sugar under control until it just cannot any longer. By getting a fasting insulin on this patient, his metabolic markers tell a completely different story. So doing testing like this can actually predict diagnoses such as diabetes up to 15 years prior to actually getting the diabetic diagnosis, just based on glycemic parameters such as your A1C. Now, why is this important? Well, insulin resistance can single-handedly be the cause of large amounts of disease processes happening in the body. These disease processes can be things such as the obvious, which is obesity, metabolic syndrome, cardiovascular disease, fatty liver disease, polycystic ovarian syndrome, kidney disease, increased risk of cancer, dementia, list goes on and on. So the next time that you are at an appointment with your provider or your primary care, ask them to run a fasting insulin test along with your other labs. Another good marker to see if there's inflammation happening in the body is a high sensitive CRP level. These markers alone can give a much better picture on predicting disease processes, especially these metabolic ones. And in fact, there are actually insurance companies that do this for a living. They can predict almost to the month of you needing a medical intervention based on biomarkers such as these. And unfortunately, until this is integrated into standard practice, you must ask for better care. The more you know, the better you can do.